Breathing through the nose is dependent on different anatomical structures that we always have to keep in mind when you do a cosmetic rhinoplasty. And so the septum is in the middle, and that can be deviated one way or another and can be obstructing the airway. The septum interacts with the upper lateral cartilages, and that's called the internal nasal valve. So that can be collapsed or narrowed, and typically we have to treat that with spreader grafts, that's cartilage grafts, or other techniques. Now, the side wall, there's a turbinates that can be inflamed or enlarged and can be pushing and obstructing inside the nasal airway. And then at the floor, where the septum interacts with the floor of the nose, there's some spicules or bony components of the septum that often are not treated enough and should be treated a little more when you do a rhinoplasty. And then the external nasal valve, that's where the lower lateral cartilages or the nostril is, and that can affect breathing as well, especially when it's collapsed or the cartilage is weak and buckling on itself. So all these are very important things that we have to always keep in mind when we do a cosmetic rhinoplasty, but even more importantly, when we do a revision cosmetic rhinoplasty or rhinoplasty of any kind. Now, before we even consider doing a surgical procedure like rhinoplasty, especially in somebody who has some obstruction, we have to first assess for medical condition that could be causing obstruction, and that can be treated with medications and don't require surgery. And that's all part of the preoperative assessment.